This video is about CAR-T therapy, a new treatment option for relapsed and refracted multiple myeloma. Just as a disclaimer, the information in this video is just for educational purposes and is not any sort of medical advice. And patients should always seek advice from a licensed physician with any questions about medical conditions or treatment options. And also, BioInsights is not affiliated with or endorsing any of the mentioned therapies, clinical trials, organizations, or external links in this video. So let's get into it. Imagine a single transfusion that uses your own cells to fight or even cure your cancer. That is the goal of CAR-T therapy, an advanced treatment option now being used for many types of blood cancers such as multiple myeloma. So what is multiple myeloma? Multiple myeloma is a rare and aggressive blood cancer that affects plasma cells, a type of immune cell found in the bone marrow that makes antibodies to fight invaders. So during multiple myeloma, plasma cells become abnormal and mutated and multiply uncontrollably. These multiple myeloma cells can crowd out other healthy blood cells in the bone marrow, leading to other blood-related disorders and also bone fractures and issues in kidney function. So while standard treatments like chemotherapy and blood transplants exist, multiple myeloma still frequently relapses and also refracts, or becomes harder to treat over time. That's where CAR-T therapy comes in. To understand what CAR-T cell therapy is, first we have to be familiar with T cells. T cells are a type of immune cell naturally present in the body to find and kill invaders, kind of like a targeted assassin. However, cancer cells, like the multiple myeloma cells, often find ways to evade detection by the T cells. So how is CAR-T therapy made? CAR-T cell therapy involves taking the patient's T cells and reprogramming them in the lab to have a CAR protein attached, or a chimeric antigen receptor. This chimeric antigen receptor on the surface of the T cell helps the T cell to recognize and kill the cancer cells more effectively. Now let's get into the CAR-T therapy process. The first step is T cell collection, where the patient's blood is drawn to collect T cells from their blood. This process is called apheresis. The next step is engineering, where in a lab the CAR protein is attached to the T cells. How is this done? Basically, the genetic instructions to make the CAR protein is put inside of an inactivated virus. This inactivated virus then delivers those CAR protein genes to the T cell, so now the T cell can start making these CAR proteins on its surface. The next step is multiplication, where these new CAR T cells are now multiplied to a greater number, still in the lab. The next step is infusion, where these CAR T cells are now infused back into the patient. And the fifth step is attack, where the CAR T cells now go out and attack cancer cells in the body. So this image just illustrates the process I just explained. So the first step is the blood being drawn from the patient to collect their T cells. The next step is the CAR protein genes being delivered to the T cell. The next step shows the T cell with the CAR proteins formed on its surface. And the next step is the CAR T cells multiplied to a greater number. And the last step is the infusion back into the patient. So let's focus on the scientific basis of CAR-T for a second. So CAR-T cells work by using an antibody, which is a receptor that recognizes a specific protein on the surface of the cancer cell. So in this image, the antibody is shown in purple, and it attaches specifically to the protein BCMA, which is on the myeloma cell. So when the antibody binds to the protein on the cancer cell, it triggers a chain reaction inside of the T cell that causes the T cell to release toxins, like cytokines, which destroys the cancer cell. This is why it's important that the CAR T cell antibody targets a protein that is only on the cancer cell, or else it could mistakenly attack healthy cells. And both of the approved CAR T therapies for multiple myeloma target the protein BCMA because it's found exclusively on myeloma cells. So, as mentioned on the previous slide, there are currently two FDA-approved CAR-T therapies for multiple myeloma, and those two therapies are Abecma and Carvykti, and this is as of August 2025. However, both of these treatments can only be administered to the patient after the patient has undergone previous treatments already. For example, Abecma requires the patient to have already gone through 2 or more lines of treatments, including an immunomodulating agent, a proteasome inhibitor, and an anti-CD38 monoclonal antibody. Meanwhile, with Carvykti, only 1 or more prior lines of treatments is required, including an immunomodulating agent and a proteasome inhibitor. How does CAR-T therapy compare to standard therapies then? So, one benefit of CAR-T therapy is that it's shown largely successful results so far. In the description below, I put a link for an FDA trial of Carvykti, so you can check that out if you want. And additionally, CAR-T therapy only needs a one-time infusion compared to rounds and rounds of chemotherapy or blood transplants. However, there are many challenges associated as well. One really common side effect of CAR-T therapy is cytokine release syndrome. This is basically when the patient's immune system becomes hyperactive and releases an excess of toxins, which can be harmful to organs and other body functions. Another common side effect is immune effector cell associated neurotoxicity syndrome. This basically includes neurological issues that can range from confusion and nausea to difficulty speaking and more serious things as well. Another major downside is the cost of CAR-T therapy, as it can cost well into the hundreds of thousands of dollars actually, considering how new the therapy is and the cost of the personalized manufacturing, etc., etc. But overall, thanks for watching this video. I hope it was educational in some way, and I've linked additional patient support resources in the description below, so be sure to check that out. Also, be sure to follow this account, BioInsights, on YouTube, and also take a look at my webpage, www.bioinsights.health. Again, thanks for watching.